Reinke's edema, otherwise called polypoid corditis or polypoid laryngitis or smoker's larynx, one of the cause of hoarseness. And there is fluid accumulation in the Reinke space. Anatomy of Reinke space was detailed earlier. Smoking, phonotrauma and upper respiratory tract infection and laryngopharyngeal reflux are the risk factors for developing Reinke's edema, with smoking thought to have the most significant impact. Pathology shows epithelial thickening, hyperkeratosis, basement membrane thickening and submucosal edematous lakes. Clinically, this is associated mainly with a lowering of the fundamental frequency and a resultant low-pitched voice. Deepening of the pitch of the voice with woman being mistaken for a man, particularly on the telephone. And also there is gruffness of the voice, inability to raise the pitch of the voice and also choking episodes. Hear the voice of mainly raspy.
It's abusive. I have this very large, polyp on my vocal cord, which is giving me a lot of the tone and the texture that has made me warm with, because it's like running a marathon with ankle weights on.
The appearance can be graded and there are multiple grading systems, and the one given here is from Scott Brown textbook of otolaryngology, with grade 1 showing a marginal edge edema, grade 2 obvious sessile swelling thrown over vocalis muscle during phonation, 3 large bag-like swelling filled with fluid, and 4 partially obstructing lesion with medial border in contact almost most of the length. Evaluation of the patients with Reinke's edema include visualization of the larynx, perceptual evaluation of the voice and documentation of vocal outcomes. For visualization and analysis of the larynx, we have to do a diagnostic laryngoscopy, and that is most commonly performed in the office using indirect visualization with a flexible fiber optic endoscopy. And in a patient with Reinke's edema, you can see a balloon-like swelling of the vocal folds secondary to subepithelial expansion of the superficial layer of the lamina propria. The lesion will flip in and out of the airway. And the video stroboscopy will show asymmetric periodicity of the mucosal wave, increased mucosal wave propagation and increased amplitude. Primary treatment is surgical intervention, while smoking cessation and voice therapy play an adjunctive role. Also, there is role of anti-reflux medication. The procedural treatment options for Reinke's edema include cold steel excision, carbon dioxide laser or microdebridement, photoangiolytic laser and intralesional injection of triamcinolone or an intralesional hyaluronidase injection.